Hello, welcome back, and thank you for subscribing to my channel. Today, I'm going to talk about the impact of lifestyle and nutritional supplements on menopausal depression. To learn more about this and how it's diagnosed, watch this video. If you or someone you know is navigating this challenging phase, please stick around as we explore some eye-opening facts and practical solutions. First, let's take a brief overview of menopause and its mental health implications. Menopause marks a significant hormonal and neurobiological transition in a woman's life, not just physically, but mentally as well. Did you know that 1 in 5 women will experience an episode of major depressive disorder, or MDD, during their lifetime? Even more concerning, 50 to 70% of those women will have more than one episode. The stakes are high, with women who suffer from depression being 1.5 times more likely to die from heart disease. And for women over age 65 with significant depressive symptoms, the risk of dementia increases. Now let's discuss how lifestyle factors can influence mental health during perimenopause. For instance, being overweight, obese, or a smoker increases the risk of depression by a staggering 56%. But there's good news. Regular low to moderate intensity exercise can significantly improve depressive symptoms. Speaking of exercise, let's explore the dose-response effect on depression. Research shows that some physical activity can reduce the risk of depression by 22%. Engaging in 2 to 4 sessions of moderate to strenuous exercise for just 20 minutes a week can cut the risk by 33%. And if you manage 4 sessions or more, the risk reduction jumps to 44%. Now let's talk about nutrition. The Mediterranean diet has been highlighted by the European Menopause and Andropause Society for its potential benefits, including improvements in vasomotor symptoms, cardiovascular risk factors, and mood. Specific nutrients play a vital role as well. For example, a lower dietary intake of vitamin B6 has been linked to more severe depressive symptoms among middle-aged Japanese women. Foods rich in B6 include chicken, fish, organ meats, potatoes, and fortified foods. Recommended intakes are 1.3 mg for adults aged 15 to 50 and 1.5 mg for women aged 51 and older. Additionally, higher intakes of added sugars and lower intake of zinc and magnesium are linked to a higher risk of depression. Vitamin C deficiency may also contribute to depression onset, while omega-3 fatty acids work to regulate inflammation and prevent neuroinflammation. A 2020 observational study published in the journal Climacteric found that perimenopausal women had lower intakes of protein, zinc, folate, tryptophan, B12, and omega-3 compared to premenopausal women and postmenopausal women. And women without depression had higher intakes of dietary polyunsaturated fatty acids. Furthermore, higher fiber, fruit, and vegetable intakes were protective against depression. Side note, another valuable tool is cognitive behavioral therapy, or CBT. It helps individuals identify and correct inaccurate thought patterns while encouraging engagement in pleasurable activities. This can be particularly beneficial for managing depression, insomnia, and hot flashes. CBT is delivered by qualified clinical psychologists, and benefits can be seen in 12 to 16 weeks depending on the individual, with long-lasting results. Let's take a quick look at some specific supplements that have shown promise in research. B6 supplementation at 75 mg has shown promise in improving anxiety in older women. However, caution is advised regarding dosage, as it can lead to B6-induced neuropathy. A small RCT of 96 Japanese women aged 40 to 60 years showed that 1,200 mg of soy lecithin improved vigor. Vitamin D supplementation can help those who are deficient. An RCT of 120 middle-aged women with moderate to severe psychological distress without major depression given 1.05 grams of ethyl EPA for 8 weeks showed significant improvement in psychological well-being and depression scores. The lowest quartile of dietary creatine intake was associated with a 31% increased incidence of depression. Vegans and vegetarians are at increased risk of low creatine. Creatine supplementation for 8 weeks with regular antidepressants reduced depressive symptoms in women with major depression. A 5-gram daily dose appears to accelerate the antidepressant response. In a 2023 systemic review of 5 RCTs in over 400 postmenopausal women found that melatonin improved depression and anxiety symptoms. Doses used range between 0.5 to 5 milligrams at bedtime for durations between 4 weeks to 12 months. In conclusion, lifestyle and nutritional interventions are crucial in managing menopausal depression. But remember, it's always best to consult your doctor before making any significant lifestyle changes or starting new supplements. Together, we can navigate these challenging times. I would love to hear from you. Please leave your comments, share your experiences, and don't forget to subscribe for more insightful content on mental health and wellness. For the resources, check out the links in the description. Take care, come walk the talk with the doc, and I'll see you next time.